All right, let's embark on a comprehensive tour of a modern computed tomography machine. We're going to peel back the layers of this incredible device, moving from its external form to the fundamental physics and sophisticated engineering that allow it to see inside the human body with breathtaking clarity. We'll explore precisely what it is, how its core components work in concert, and ultimately, why this technology is such an awesome and indispensable tool in modern medicine. First, let's address the most prominent feature. This large donut-shaped structure is called the gantry. It's far more than just a housing. It's a marvel of precision engineering, designed to contain and rapidly rotate the entire imaging system around a patient with perfect stability. Inside the gantry, we find the two most valuable players of the CT world, the core components responsible for generating and capturing the data. On one side, we have the X-ray tube. This is a powerful, specialized vacuum tube that generates a controlled beam of X-rays. It works by accelerating a stream of electrons to incredibly high speeds and crashing them into a small metal target, typically made of tungsten. This collision releases a tremendous amount of energy, a tiny fraction of which is emitted as X-ray photons. The rest becomes intense heat, which is why the gantry incorporates sophisticated cooling systems. Directly opposite the tube is its crucial partner, a wide, curved arc of detectors. Think of this as the scanner's camera. It's an array composed of thousands of tiny, individual detector elements. Each element is a solid-state device, typically a scintillating crystal paired with a photodiode, designed to do one thing with extreme efficiency: catch any X-ray photon that passes through the patient and instantly convert its energy into a tiny electrical signal. The number and size of these elements are key determinants of the scanner's image resolution. The patient rests on this motorized table, which is engineered to slide you through the center of the gantry with sub-millimeter precision. This movement must be perfectly synchronized with the imaging process, while the table moves you through the entire internal assembly of the X-ray tube and detector array spins around you at incredible speeds, sometimes multiple rotations in a single second. This is made possible by a brilliant piece of engineering called slip rings. These are concentric conductive rings that allow power to be transmitted to the spinning components and, just as importantly, allow the vast amounts of data from the detectors to be transmitted out, all without a single physical cable to get tangled or unwind. This innovation was the key that unlocked modern, high-speed helical scanning. As the system rotates, the tube emits a thin, fan-shaped beam of X-rays that passes through a cross-section of your body. This process is called attenuation. As the X-ray photons travel through you, they are either absorbed or scattered, meaning not all of them make it to the other side. The amount of attenuation depends entirely on the density of the tissue the X-rays encounter. Very dense materials, like bone, block a large number of X-rays. Less dense materials like muscle, fat, and organs, what we collectively call soft tissue, block far fewer, and materials with very low density, like the air in your lungs, block almost none at all. The detectors on the other side are meticulously designed to catch every single photon that successfully makes it through. They measure the intensity of the X-rays that reach them at thousands of points along the arc. This generates a massive, continuous stream of raw data. For every angle of rotation, the system gets a one-dimensional projection of X-ray intensities. This raw signal is sent to a powerful, dedicated data acquisition system which digitizes and organizes these millions of individual measurements. Now for the computational magic. This raw data is essentially a collection of shadows taken from hundreds of different angles. It's not an image yet. To turn it into a diagnostic picture, the computer employs complex mathematical algorithms. The foundational technique is called filtered back projection. The computer essentially takes each projection profile and projects it back across a grid. By layering all of these projections from every angle, the anatomical structures are additively reinforced, and a recognizable cross-sectional slice is reconstructed. More advanced systems use iterative reconstruction methods. These start with an initial guess for the image, simulate what the scan data look like, compare it to the data, and then intelligently correct the image. This process repeats, or iterates, refining the image with each loop to produce a much cleaner, more accurate result with fewer artifacts. And today, the cutting edge involves AI-assisted methods, deep learning algorithms trained on vast libraries of scan data, can differentiate between true anatomical detail and unwanted signal noise with incredible sophistication. This allows them to produce exceptionally clear images, often while using a significantly lower radiation dose. The result of this reconstruction is a digital image where every single pixel is assigned a precise numerical value on the Hounsfield scale. This scale standardizes the measurement of tissue density. By definition, dense cortical bone is assigned a high positive value, often 1,000 or more. Pure water is the reference point, defined as exactly 0, and air, which barely attenuates X-rays at all, is defined as negative 1,000. All other tissues in the body fall predictably within this range. Fat is slightly negative, while soft tissues like muscle and organs are slightly positive, allowing radiologists to differentiate them. Modern scanners don't just take one slice at a time. They perform what's called a helical or spiral scan. This combines the continuous rotation of the tube and detectors with the smooth, continuous movement of the patient table. The result is that the X-ray beam traces a spiral path along the patient's body, acquiring a whole volume of data in a single fast acquisition, often in just a few seconds. A key parameter here is pitch. This is the ratio of how far the table travels in one rotation to the width of the X-ray beam. A higher pitch, where the table moves faster, allows for a very quick scan with a lower radiation dose, but the helical loops are spread further apart, potentially sacrificing some fine detail. A lower pitch is slower and uses more dose, but gathers more overlapping data for higher image quality. The technologist also selects the slice thickness. From the volumetric data, the computer can reconstruct images at any thickness. Thinner slices provide greater spatial resolution, meaning you can see smaller objects, but they can also appear noisier because each slice is built from less data. Thicker slices have less noise but can blur small details. The choice is a careful balance tailored to the clinical question. To make certain structures stand out, we often use a contrast agent. For imaging blood vessels, a sterile iodine-based liquid is injected into a vein. Because iodine is a dense element, it strongly attenuates X-rays. As it circulates through the body, it causes the blood inside arteries and veins to light up brightly on the scan, providing a detailed roadmap of the vascular system. This technique, called CT angiography, is critical for diagnosing life-threatening conditions like blood clots in the lungs or brain, identifying aneurysms before they rupture, and assessing blockages in the coronary arteries that supply the heart. So, what is all this technology used for? The applications are vast. In emergency medicine, it's the workhorse for trauma scans, allowing doctors to rapidly assess for internal injuries from head to toe in a matter of seconds. It's essential for stroke triage, where a non-contrast head CT can instantly spot bleeding in the brain. It's used for screening and diagnosis of lung cancer by detecting small nodules, and it's the gold standard for identifying painful kidney stones. In oncology, CT is fundamental for cancer staging, determining the size and spread of tumors. It's used for precisely planning complex surgeries or mapping out radiation therapy treatments. It even enables non-invasive procedures like virtual colonography, providing a 3D fly-through of the colon as an alternative to traditional colonoscopy. Of course, with any technology involving X-rays, safety and radiation dose are paramount. The medical community takes this extremely seriously. We measure dose using standardized metrics like CT-di-vol, which reflects the radiation intensity for a single slice, and the dose length product, which accounts for the total length of the scan. From this, an effective dose can be estimated, which helps relate the radiation exposure to the risk of long-term health effects. Every scan is guided by the Alera principle, as low as reasonably achievable. Technologists don't use a one-size-fits-all approach. They meticulously optimize scan protocols based on the patient's size and the specific medical question, using the lowest possible dose that will still yield a diagnostic quality image. They also use shielding for sensitive areas, outside the scan region when appropriate. Before any scan, it's vital that you communicate with the clinical team. They need to know if there's any chance you could be pregnant, if you have a history of kidney problems, or if you've ever had an allergic reaction to CT contrast dye in the past. This information ensures your safety and allows them to take any necessary precautions. So, the bottom line is this: a CT scanner is a symphony of physics, engineering, and computation. It combines the penetrating power of high-speed 3D X-rays with incredibly smart mathematics to create clear, detailed, cross-sectional pictures of your anatomy. Images that give your doctors the crucial information they need to act decisively and effectively. That's the tour. an elegant solution to one of medicine's greatest challenges, seeing clearly inside the human body.